Hello, everyone, and welcome to this month's Northwest ATTC webinar. And I'm Jennifer Burbeck. I'm your host for today. We're excited to have Dr. Bill O'Connell and Ursula Heflick presenting for us today on Washington State Builds a Stronger Mental Health Workforce, introducing the Behavioral Health Support Specialist. Next slide, please. Couple of quick housekeeping things. First, if you have any questions for our presenters, please type them into the chat box at any time, and we'll try to answer as many as we can throughout the presentation, and whatever we're not able to get to, we'll answer at the end. You'll also be getting an email at the end of today's webinar that has a link to a survey in it. And please make sure you take that survey, as it helps us bring the content that you're interested in, and it also helps us continue offering free or low-cost events such as this one. That email will also have a link to download the slides from today and a link to our website where you'll be able to find a recording of the webinar, and that should be available sometime this afternoon. Next slide. We'll also be sending everyone who attends this live webinar a certificate of attendance, and it takes us about a week to get those out. You don't need to do anything to get the certificate unless you're watching this in a group. And if that's the case, just send us the names and email addresses for everyone who wants a certificate. And you'll see our email address up there on the slide. It's northwest@attcnetwork.org. Next slide. Okay, now on to our webinar. I'm pleased to introduce our speakers today. We have Dr. O'Connell, who is a licensed mental health counselor and national certified counselor in Washington State, with 35 years of experience providing mental and behavioral health services across a variety of settings. And Bill is also currently an associate professor at the University of Washington. We also have Ursula Heflick, who has been an instructor at Spokane Falls Community College since 2013. And is also the program lead of the Behavioral and Applied Science program in integrated behavioral health. And before she became an instructor, she worked as a licensed mental health counselor and a substance use disorder professional. And with that, I'll turn it over to them and they can expand on that introduction. Thank you so much for joining us today, Bill and Ursula.
Thank you for having us, Jen. So I'm Ursula Heflick, and I will get us started. But first of all, thank you to everybody who made the time to be here. This is fantastic. So this webinar is called Washington State Builds a Stronger Mental Health Workforce, introducing the Behavioral Health Support Specialist, the BHSS. So another acronym has been added to the behavioral health field. And as mentioned, I'm the program lead of the bachelor's program at SFCC in Spokane. And Bill, what would you like to say?
Sure. Yes, we're really happy to co-facilitate this webinar today on developing a new member of the workforce. And I think really I'm honored to co-present with Ursula, who will be one of our education partners helping to deliver the curriculum for the behavioral health support specialist in Washington State, specifically at Spokane Falls Community College. And later in the presentation, we'll talk about other colleges and universities who are working with us also. In just a moment, I'll put in a few links to some important websites that might be helpful for those participating to have access to. One of those will be the UW BHSS website. Another will be an article that was in Psychiatric Services Journal published in April that provides a really brief overview of the project itself that you can share with anyone who also might be interested in this work who's not able to be at this presentation today. I did want to just say part of what inspired me to do this work is I recently worked in integrated care for a national healthcare company, and I worked alongside physicians and nurses and other healthcare providers on a day-to-day basis. And our bachelor workforce was usually in the form of a medical assistant or a health coach. And I was involved in doing a lot of training with these individuals and really saw the potential for persons who are at the bachelor level to have a huge impact on the well-being and the whole health of our patient population. So when this opportunity came up to help build a new workforce, I jumped at it. And my background is I've trained graduate level mental health counselors for over 25 years. And very early on in my career, I was a addictions counselor. However, that's not something I've stayed up to date on. So I lean in on Ursula to help with that a little bit. But we're really happy to be able to present this to you today. So Ursula, I'll give it back to you.
All right. Thank you, Bill. Jen, next slide, please. Or Meg. I think it's Meg who's moving them. Okay, all right. So here is the disclosure. The speaker, so neither Bill nor I report any financial conflicts of interest related to the presentation. And in terms of the rules and regulations and the Washington administrative codes that are referenced in this presentation, including the CR 102, those are, well, they are advanced drafts. They are still open to public comment. So some of the material presented is conditional and subject to change. So the final word hasn't been spoken yet, but the process is quite far advanced already. Next slide, please. Okay, so what is to from about? I'll just read this and a little bit. So the mental and behavioral health workforce shortage has hindered access to care in the United States, including in Washington, resulting in long wait lists for persons who need behavioral health care. Bachelor-level practitioners are one solution to increasing available mental and behavioral health treatment across a variety of settings. And a behavioral health support specialist, a BHSS, will provide brief treatment for depression using behavioral activation, anxiety using CBT, cognitive behavior therapy, and engage in harm reduction for substance use issues. And in this webinar, we will highlight an innovative effort in Washington State that is meant to initiate a bachelor's level BHSS curriculum that will lead to credentialing to expand the mental health and behavioral health workforce and improve and increase access to care. Next slide, please. Okay, so this is what you're supposed to get out of today's webinar. Number one, participants will understand the relationship between approved bachelor programs in behavioral health, psychology, and social work and the new state BHSS credential. So how do programs prepare for the credential? Number two, participants will recognize the role and function of the BHSS in the various settings they can practice under supervision. So what is their scope of practice? And then number three, participants will distinguish between substance abuse treatment work and BHSS interventions because there's a difference. Next slide, please.
So we want to be able to describe to you the background and rationale for this workforce project and sort of how it came to be in Washington State. And in doing so, that will help prepare us for talking more about how this role will work within different employment settings within Washington State as well. So we'll go to the next slide. So the things that we really were paying attention to at the University of Washington, but also in other discussions across the state, where is the behavioral health workforce shortage, and that includes the delivery of mental health services as well as substance use disorder interventions, but also the places where behavioral health can occur. So I think this effort really started in 2018 when we presented at the Washington Mental Health Workforce Summit, which was held at the UW campus, and really described approaches to being able to address workforce shortage. And one of those solutions, and there's many, by the way, this isn't the only one, is to help expand the bachelor level workforce. So in doing so, we also hope to address the need to provide a full range of treatments for persons who are seeking help. So one of the most common places that the general population will seek help with both their general health, but also behavioral health, is in primary care settings. And often the first course of treatment within primary care is to administer medications, such as antidepressants or anti-anxiety medication. But studies have shown that persons who are seeking help within primary care settings actually want to be offered psychosocial interventions or behavioral health interventions, either in combination with or as a first course of treatment, but that's often just not available. So what we want to do is to be able to provide that full range of treatment. And then a need for increased access care for all. So that persons who are seeking help or a mental health condition or behavioral health condition can have access to it where and when they need it. I was recently working, as I mentioned, in integrated care. I specifically was working with the senior population, so 65 and over. And many times I would meet with individuals who had been dealing with intense stress throughout different points of their life, but who told me they had never met with a mental health or a behavioral health professional in their lifetime. And I thought that was really unfortunate because I think access to this kind of care is so important just in terms of how we develop across those different life stages. And so we want to see access both for our youth as well as young adults and into working with seniors. So next slide, please. So addressing this idea of workforce shortage, and I know there are persons on the webinar who represent other states. I know someone mentioned they're from Alaska. And every state addresses workforce shortage in different ways. But this map that you're seeing is probably true for most states. So the dark blue areas are what are called federally designated mental health workforce shortage areas. So you can see in Washington state that includes most of the state, with the exception of the light blue area is King County. And that's, of course, where Seattle's located. So that area is not considered a federally designated workforce shortage area. Now, people living in King County might, or working in King County might disagree with that, but in terms of the number of people who are there, there's a much higher percentage. So what we're wanting to do is think about this as a statewide effort. And this is not limited to just the Seattle area, but this is for the whole state. And Ursula is representing the Spokane region, which is off to your right side. So we'll go to the next slide, please. We would like to be able to build this model within a stepped care perspective. And of course, this is an ideal state and not necessarily how our current behavioral health system works. But there are models of this kind of a system, both I think within the US, but where we have seen it externally. So England is a good example. There's this kind of a role that we're discussing today is one of the things we were inspired by in terms of thinking about how services can be offered in different ways through both prevention efforts as well as helping people to engage in self-directed care, but also having brief services available. And I think that's really important because we really don't do a great job of offering people brief services and interventions during crisis periods in their life. And I think we can do a much better job of that. In addition to helping to bolster the workforce within our intensive services, which many of the people on the call probably are involved in, as well as other community and recovery supports. So the behavioral health support specialist is really going to help with the brief services, the community services and recovery supports, and also contribute to intensive services. They're not intended to replace or be a substitute for specialized services or for those services offered by master's and doctoral level providers. They're there to support that work. And the next slide, please. So one area that we saw as an opportunity here in Washington State was really working with the bachelor level provider type. So some of this may be unfamiliar if you're outside of Washington, but we do have a certified peer counselor role in Washington State, which is certainly very important, especially with our recovery communities. And then there are the substance use disorder professionals, or SUDPs, which is achieved at the associate level within Washington State. Again, a very important role contributing to the health and welfare of those seeking recovery. But then to provide mental health services in Washington State, usually you need a master's degree or a doctoral degree to do that. And those roles are really important and they will continue to be very important. But I think one thing that we're recognizing is that we can't let that be the only solution to the workforce shortage. And just for those who may not be familiar, the work that I'm doing is funded by Bomber Group, which is a philanthropic organization in Washington State. And one of the things that the Bomber Group did was they funded workforce expansion on multiple levels. So one of the things they did was create a scholarship fund for persons interested in getting a master's degree in either clinical social work or mental health counseling. And they've so far funded, I believe, almost 400 scholarships across the state of Washington for that role. And this work is really important. In addition to that, they funded the behavioral health technician, which is more of an entry-level role into the mental health field. It's a year-long apprenticeship. But again, this is what we're working on is really expanding workforce at the bachelor level. So in Washington State, there's currently not a bachelor level role that can bill state Medicaid or third-party insurance. And that's really important for agencies and employers to be able to recover the cost of services. So we wanted to create a role that would be positioned to do that. And thank you, Laura, for helping with that. Yeah, so the clarification on what I just said is that I was referring to Balmer, B-A-L-M-E-R. Steve Ballmer was the former CEO of Microsoft, who, together with his family, has helped to fund efforts such as this, but many other efforts to expand mental health workforce.
Well, I'm not sure if you saw the other question in there, and you may have kind of already addressed this, but one of them was, is this designation aimed at folks currently in undergrad or contemplating getting a bachelor's versus those with a bachelor's already working under an AAC license?
Right. So this is a role that is for those who are going to be enrolled in a bachelor's program, and it's going to provide people who enroll in these programs the opportunity to do this work. If somebody already has, in Washington State, we have a designation called agency affiliated counselor, which is a very important designation that helps provide workforce within our behavioral health organizations. So people with the AAC can continue to do that work within the behavioral health organizations. And actually, the AAC is being expanded to have different levels of credentialing and licensure. A behavioral health support specialist can work in behavioral health organizations, but they also can work in other settings. So they'll be able to work in integrated care settings, in often the future in school-based mental health, and in any setting where behavioral health is offered and appropriate supervision is provided. So it's different in that it's a credential that's portable, and it's something that stays with the person, and they take it with them within the state of Washington anyway. So for somebody who has an AAC, they have a couple of options. One is they can talk to a program such as Ursula's, the Spokane Falls Community College, about what courses they would need to take to be able to achieve that designation. And then another option is, of course, they can still pursue a master's degree, which is another way to go. And there are some schools looking at doing a standalone post-baccalaureate for this. As we get into this more, we can talk about it, but I think it is a big time commitment in terms of learning. So someone would need to make a decision. Do I really want this designation, or do I want to pursue a master's degree? So that'll be a question that each individual will need to ask themselves. Does that help with answering that question? And okay, I think we can move on from this. So we'll go to the next slide. And so what's required, I think there was a question around, will there be a credential for this? So the answer to it is yes. So to be credentialed, you'll need a 4-year degree in psychology, social work, behavioral health care, or a related degree program that has this BHSS specialization. So what's unique about this, and where I think Spokane Falls Community College and other BAS programs are uniquely positioned, is that this is about learning applied skills. This is about learning how to actually counsel someone who has depression, anxiety, or another common mental or behavioral health condition, and they're providing treatment. And currently in Washington State anyway, psychology and social work programs typically have not taught these kinds of skills, because in order to practice in that way, you had to go on and get a master's degree. So this is changing that, so that there will be an opportunity now for bachelor level persons to be providing a level of care that's considered treatment. And so that's what I think is unique about this. There are other states in the United States that have bachelor level credentials. Usually those are licensed social workers. What's unique about this in Washington State is that the BHSS is not tied to one guild, meaning it's not just for psychology or social work or some other guild. It's actually one that can prepare someone to go in many different directions if they choose to pursue graduate level work. And this idea is actually quite appealing to a lot of our behavioral health professions, in that this is an opportunity to get a sense of what it's like to work in this field, and to determine where someone feels really called in their career. Do I identify more as a social worker? Do I identify more as a psychologist? Do I identify more as a mental health counselor or nurse or some other area? And to be able to choose that freely if they want to pursue that kind of training and education. But this can also be a career in and of itself. So someone can become a behavioral health support specialist, and that in itself can be a career for that individual working in the field. And Dylan, I'll get to your question a little bit later about pathways for AACs, but thank you for asking that question. And so, Ursula, I think I'm going to pass it back to you.
Thank you. All right, next slide, please. Okay, so first learning objective is to understand the relationship between approved bachelor programs in behavioral health, psychology, and social work, and the new state BHSS credential. Next slide, please. Okay, and this might address Dylan's question a little bit, not fully, of course, and Bill, you might have much more information pertaining to that question. But anyhow, let's talk about the programs that offer the education that leads to the BHSS credential. So programs must apply to the Department of Health to be considered a BHSS approved program. And once they have done that, they are considered a provisional program. So they are not immediately fully approved. There are quite a few conditions associated with the approval process. For instance, and this sounds a little bit technical, but here, bullet point number 2, there is alignment with 29 out of 34 competencies listed in the WAC, the Washington Administrative Code, using the current gap analysis tool provided by the department, that's the Department of Health, and the University of Washington. So what that references is that education partners have worked with the University of Washington in identifying how much their educational offerings already align with the requirements of the BHSS curriculum and what needs to be included in the programs they might still be creating. And so quite a few programs who have been part of this effort already are in alignment with a lot of the competencies that are required, but others have to add classes or rewrite some curriculum. And I'll speak more about those competencies that are mentioned here. And the educational program has to continue to be aligned with the Department of Health requirements to achieve full compliance. And this includes that the practicum sites that students choose for their practicum hours meet the requirements of the Washington Administrative Code. This means that the instructors who teach the practicum or field placement classes have to make sure that those practicum sites work, that they are appropriate sites. And a fully approved program such as SFCC is planning to be, have to, after their initial approval by the Department of Health, reapply every 7 years to make sure that they are current in terms of what they offer students and what they teach. And also, when they make any substantial changes to their curricula, those programs have to let the Department of Health know about that within 2 months. And the Department of Health will conduct audits of the programs to see if they are in compliance with their requirements. Also, something I would like to mention here is that BHSSs will be taking an exam that is part of the BHSS credential. So educational programs have to teach toward that exam, of course. Next slide, please. That's back to you, Bill.
Yeah, so what we're working to do to scale this role for Washington State is to, what we're doing at UW Seattle is we're serving as a catalyst for this role. So we're helping to create a model curriculum for this and share that curriculum across the state in terms of any college or university that wants to adopt the curriculum itself. It's also intended to be integrated into an existing four-year degree program so that we don't have to start a brand new program, if you will, for this role, but to lean in on the expertise of our existing faculty within our behavioral healthcare programs, psychology, social work, and perhaps other programs that may adopt this off in the future. And what you're seeing are a sample of the colleges and universities that will be delivering this curriculum. There are others who are currently engaged in a self-study that will be offering this curriculum in the future. And you're seeing a bit of an empty space in the middle of the state right now. But there are community colleges and universities who will be offering, I already know who will be offering this, not in 2024, but likely in 25 or 26. And I can tell you that, for example, Wenatchee College and Big Bend College, I've already submitted a request to the state to start a BAS program that will also serve as a BHSS program that will help with the north central region of the state. And there's a university looking at this down in the Walla Walla, Franklin, Benton region, Tri-Cities area. There's also a Clark County College looking at this. Olympic College, which is in Bremerton, has already committed to doing this work. And I did not intend to leave them off, but Olympic College is part of this as well. So you're going to see this continue to expand. We believe this is really advantageous for the state of Washington. We're also really excited that this is a partnership between our universities and our state colleges, whom I think have the ability to really train workforce where people live and plan to work. That's the intent of how we're planning to engage education partners and how this will continue to develop. All right. And I think, Dylan, because thank you, keep asking the questions, but the AAC is so unique, I'm going to just address that all at one time towards the end. So we'll go to the next slide, please.
Okay, so
yeah, did you want to cover this?
Yes. Yeah. Unless you want to cover this slide, and then we'll go into more detail.
Sure. So what we've been developing at the University of Washington is the curriculum for this role. And we engaged in discussions with different professional associations and employers and trade associations and payers to find out what does this role really need in terms of competencies to be able to function successfully in a generalist kind of way throughout the state. So these are the large topic headings for what's being covered. Much of this is actually already covered in most of our four-year programs. The areas that are less, where there's a need to expand a course or actually add courses, is probably more under number 5, which is screening and assessment, and also 7 and 8, interventions, and then the legal and ethical responsibilities of a new provider type. So The interventions piece is what we're also helping to develop training for, so that colleges can deliver this in a way that helps prepare people to actually do this work. One of the things we've developed at UW is what's called an intelligent tutoring system. And it's a software program that we're sharing with colleges and universities. It was a joint effort between our department and game sciences to help prepare students to have counseling skills or develop counseling skills, but also intervention skills in a very systematic way, but also to speed it up, as it were. Because I think there's not a lot of time in four-year degree programs to do all of this work. So we wanted to be able to help our colleges and universities prepare students. So we've been piloting this for many years at Eastern Washington University and UW Bothell, and I think Heritage helped us out with this at one point, and also like Washington Tech. And the feedback we've been receiving is that it allows students to learn the skills in a much more rapid way than some of the traditional teaching methods that we've been using in the past. So we're excited about this and really happy that we can help assist in this way. All right, back to Ursula.
Okay. And in terms of some of the meta competencies here, Bill and I put together a list of course learning outcomes and assignments that might be part of that. So for instance, for the first meta competency, health equity, this is an exploration of the social determinants of health and how and how much they impact a person's well-being or lack thereof. And as far as the helping relationships are concerned, students will be well versed in trauma-informed care, will also be exposed to the basics of cognitive behavior therapy, behavioral activation for depression, for instance, and also motivational interviewing. And as far as the cultural responsiveness is concerned, that is closely tied to health equity because a lot of our social determinants of health are rooted in our culture. And the team-based care and collaboration. So here, for instance, for BHSSs, what is important for them to study and practice in the programs, in the educational programs, is interprofessional communication, because BHSSs are very likely to be working in settings where there are members of multiple disciplines who all have their own language, their own jargon, and so the BHSSs can really understand and communicate well. Screening and assessments, you talked about that, Bill. As far as case management is concerned, so for instance, one of the skills that students will learn is to maintain a tracking system that allows them to follow how clients/patients are doing and how they respond to their interventions and the other interventions in the clinical setting. And also to make sure that that the communication flow between the agency in which the BHSS works and its various departments and other providers, that is functional and benefits the client and patient. And also to be able to make referrals to other providers, and then again track whether clients use community-based services, medical services, etc. And in terms of the interventions, motivational interviewing here is pointed out or is listed in by the Department of Health as being important here. For BHSSs, to practice, and also crisis management, suicide intervention, those kinds of things. And also the delivery of screening, brief intervention, and referral to treatment, the SPIRT, for the BHSSs who do not have a background in substance use disorder treatment. For instance, they still learn to administer the SPIRT, and of course other assessments. And legal, ethical, and professional issues. There is an emphasis on a good foundation in professional ethics in the BHSS programs. Next slide, please. Hey, the second learning objective, participants will recognize the role and function of the BHSS in the various settings they can practice under supervision. Next slide, please. So, sorry, I just saw a question from Lorelei. Will this be a work at my own pace course? Those classes, at least at SFCC, they students can pursue the degree part-time. Absolutely. Full-time, part-time, whatever is realistic for the student and what works best for them. So what is the scope of practice for BHSSs? The Department of Health describes it as follows. So BHSSs provide treatment for a behavioral health condition which is impacting a client's quality of life. And they do so by delivering brief, evidence-based interventions for common behavioral health conditions. And the most common, of course, are the depressive disorders, such as major depressive disorder, and anxiety disorders. And there's some work can be done on substance use issues, but with clear parameters. And tracking and monitoring treatment response and outcomes will be very important for BHSSs. Does what they are working on with a client, do the interventions actually work? Is the client improving or the patient improving? And BHSSs also have to consult with their supervisors, especially when the client does not improve. And then, of course, there's the work of doing referrals. And let's go to the next slide. Okay, clinical supervision. So what is required in the field placement in the practicum for so that BHSSs get the appropriate supervision that is considered important by the Department of Health and is very important. So again, this is still somewhat in draft form, but it's being clarified more and more. Traditionally, the big or training counselors and case managers have been supervised by advanced social workers or independent clinical social workers, family and marriage therapists, mental health counselors, psychiatrists, psychologists. You can see here on the that is on the left, and on the right are some other changes that are specific to integrated care and that pertain to the BHSS. So for instance, physicians can also supervise, and then some providers, and here the Department of Health has stated that providers who hold a Washington state credential issued by another state agency and have the ability to assess, diagnose, and treat identifiable mental and behavioral health conditions as part of their scope of practice. So there is some flexibility here. Bill, do you want to speak to this, what this might mean to students?
Yeah, so I think one question that came up was what's the relationship between associate licensed and the independently licensed person? So as an example, I'll just use the mental health track. So a student who has an associate license as a mental health counselor and they've graduated from a nationally accredited counseling program, they've already received significant training and supervision. Now, that person may or may not have a lot of experience in delivering care. So there will still be the requirement that that person is prepared to provide supervision and has the appropriate training for supervision. But in a sense, what's happening is an LMHC is supervising an LMHCA who is supervising a BHSS, if that makes sense. So there's like this sort of training umbrella going on. And that actually is great for Washington because associates have always had a requirement that to become a supervisor, they have to actually provide supervision while they're being supervised. But they've never had anyone to supervise before. So now there's a group, the BHSS, which provides the opportunity for our associates to get that experience. That's always been required of them, but they didn't always have a lot of opportunity to do. So, so I think that's an exciting change for our state. But associates are master's level persons. They've already graduated with their degree. They're getting their postmaster's supervision. So they're working in the field. And this is just part of, I think that if I would call it stepped supervision model that will exist with this role.
There's a question in the chat, if a master level SUD, if that person could be an appropriate supervisor.
If their only credential is a substance use disorder professional and they don't have a psychology, mental health, or clinical social work license, then they wouldn't be part of this group. So because a substance use disorder professional is a highly as a specialized treatment and does not include within their scope of practice mental health. So that wouldn't be the case. But if they are duly certified or duly licensed, then that would be fine. Yeah.
Great question.
Was this a good time to address?
And there's also a question. Oh,
came in for the AAC questions that were asked previously. Is this a good time to go back to those that we skipped over, or are you going to wait until the end for those?
Sure, I can go ahead and address that. So again, the agency affiliated counselor is a designation that the Department of Health offers through our behavioral health organizations. And it's tied to employment. So it exists because someone's employed in a setting where they're providing these services, right? So it's not actually connected to their particular educational background or the certification. So there's a need for that, and it serves a really important purpose. I think, what my recommendation would be, that there are public hearings going on currently for the agency affiliated counselor expansion of the certification and the license. And they're trying to figure out like what education does an agency affiliated counselor need. If I was in AAC, I might attend those public hearings and give some feedback to the state around that to see if there's a way of maybe bridging this a bit. So that would be a recommendation I would have, is I do think there's an opportunity and a window to maybe see where there could be some potential overlap. And do some advocacy work around that. Again, this is different from other, the AAC is different from other licensures and certifications, in that it's not portable. It only works within the employment setting. So it's a unique form of credentialing, but I do think there's a great opportunity to maybe see where there could be a bridge between this and that one through the public hearings.
Hopefully that answered Dylan's questions. There was one other one that was, if we can treat anxiety and depression, would we still need to send referrals?
So somebody who's a BHSS who is working with someone who has a diagnosis of depression or anxiety, they can provide the treatment under supervision using the models of care that they're taught to provide. If the person's not improving or getting better, then there needs to be a discussion with their supervisor about whether the care that the BHSS is providing is the right level of care, or if the symptoms that the person's experiencing and the nature of their diagnosis requires a different licensure in order to provide that care. My experience working at least in the integrated care settings would be that I would say a BHSS could handle like 90% of the cases that we would address within that setting. And maybe 10% would need to be referred to someone with my level of credentialing and experience. But I really see a BHSS as being able to provide help and assistance to a really good portion of the population.
Especially since they might do so in the primary care setting. So they might actually be able to help a person before their struggles get worse.
Yeah,
because they have to wait.
Yeah. And then if you get this credential in Washington State, currently it only works in Washington State. So this is a new workforce credential. What I can say though is that there's been a lot of discussion nationally about this role and expanding this to other states. So there's a lot of interest. I've been talking with folks from New York and from Georgia and Illinois and other states who are interested in what we're doing in Washington State. But as with any new effort, right now this only applies to Washington. It's not portable outside of Washington.
Okay. In the interest of time, let's move on. Next slide, please. Okay, so what are the responsibilities of the clinical supervisor? They have to make sure that the BHSS does not exceed their scope of practice. For instance, BHSSs do not diagnose. That is still the purview of the master's level and the other more advanced degree holders. Clinical supervisors have to provide regular supervision, and there are some rules written around that right now. They have to provide competent supervision based on their own level of training and have to make sure that they are available for consultation to the BHSS necessary. Next slide, please. That's yours, Bill.
Yeah, so one of the questions that often comes up is around billing. So the Healthcare Authority has established a working group that's looking at the scope of practice of the BHSS that Ursula showed before, and then assigning the appropriate billing codes. It's a very detailed process. It also includes working in different buckets of budget. So another piece to this, though, is that third-party insurance will also reimburse for BHSS services. So the insurance commissioner has verified that they will make sure that the BHSS is available to those who need it. So again, that makes this a really accessible role for the state. And then Ursula, I think we only have time for one more slide. So why don't we do that next one and then we'll.
I can summarize the difference between the SCDPs and the BHSSs. Yeah. Next slide, please. Okay, so here are some sample skills from job descriptions. And here the SCDP, the substance use disorder professional, differs from the BHSS in terms of the SUDP working in depth in a very focused manner on substance use disorder related issues and substance use disorders. And those of you who might be SUDPs, you know that you also do a lot of intakes based on the American Society of Addiction Medicine criteria, review treatment plans, and you're held to 42 CFR, the confidentiality laws. BHSSs work alongside counselors or complement SUDP work in that their scope of practice is broader, and they scan for and treat common mental health disorders. And they might then, for instance, also inform an SUDP that they believe that maybe a person is struggling with a substance use disorder or a related issue. BHSSs provide brief interventions related to other mental health, and also work in crisis management. Next slide. So basically, the difference is that SUDPs are very much specialists, and BHSSs are generalists who, for instance, in an integrated setting, might assist a counselor or a licensed clinical social worker by providing treatments, brief interventions that are within their scope of practice. And they do so with an eye toward the social determinants of health. So they're very holistically trained. And I'll leave it at that because of the time. Next slide, please.
Yeah, I guess one of the things I want to put out there for those who might be employers is we are doing a study, and if you are interested in talking about your perspective of this role, I'm putting a link in there. You can fill out this REDCap survey, and a psychologist who's doing research from the University of Maryland on barriers and facilitators for BHSS would really love to talk with you. So you have to be an employer or a practicum provider. But feel free to sign up for that and she'll get in touch with you. We're just really, really happy to have been able to present to you today. I think some of the questions, I'm going to put in our email, bhsswa@uw.edu. We're happy to talk with you further or meet with you to discuss this, especially some of the questions around the AAC, which I think are a bit complicated to respond to. But we'd be happy to still address that with you either one-on-one or with a group if you are part of a group. So don't feel free to reach out, and we're happy to have those conversations with you. And I think, Jen, was there anything else you wanted us to maybe address before we wrap up?
No, I'm just going to do a couple of closing remarks, but thank you so much, Ursula and Bill, for joining us today. This was wonderful content, and thanks for putting your contact information on here. I'm sure you'll get some follow-up there. Thank you everyone for joining us today. Please make sure that you're filling out the survey. We'll be sending out an email later today with a link to take that, and we also provided it up above in the chat box. And right now we do not have a webinar scheduled for next month, but please check our website. You can just Google Northwest ATTC and we'll have more information about upcoming webinar events. And yeah, I think we got through most of the questions. So thank you, everyone. We really appreciate you joining us.
Thank you.